Hi, I'm Kameshwar Iranki, the founder and CEO of Proactive Digital Healthcare Services. Today I'm going to demonstrate how the remote patient care variable is going to work. You can take a close look at it as I am launching it. So basically this is the device that you are going to wear, and all once you wear it and switch it on, you're all ready to go and rock. And how it's going to work, we'll take a close look. Now, as you can see, once I launch the Aram app, so this is going to take you to the virtual doctor on hand. And once you put your security credentials, you're going to log in. And once you log in, it's going to say successfully login, and then all you need to do is connect to the device. And the way you connect to the device is to do a scan and pair so that the Bluetooth is enabled, and what you see earlier as not connected, now you are seamlessly connected with the device. And once you are connected with the device, you can continue to monitor it for various vitals. Now that it has connected to the device, now for example, as you click on the blood pressure, this would start basically engaging, and now as you can see there is a light glowing out and the interactivity is starting, and this shows basically the transmission of data on one side, and as it is touching the skin and then getting the right signals so as to process it. And very soon, in about 40 seconds, you're going to see the blood pressure and how it is going to work through, and what additional parameters like the mean arterial pressure and subsequently the pulse pressure you are going to see in this screens as well. So another 20 seconds you would have the output. And likewise, it's just not the blood pressure, but all the vital signs monitoring that includes the heart rate, the breath rate, respiratory rate, your SpO2, that's called oxygen saturation in blood, and then the mood and energy. This demonstrates the basic mental health energy like the anxiety, stress, depression, and then the energy level, whether it is normal or tired, very tired, or fatigue. So, which are very, very important from clinical standpoint also, and it increases your awareness about yourself as well. Now, as you can see, the BP, it's showing systolic and diastolic reading of 123 by 80. So now I'm going to pause here and unpair it, and then going to show you the entire dashboard reports, which is fantastic and transformative in nature. So as you can see here, it shows the diastolic as 123, and then the systolic to diastolic you have 123 by 80, and then daily, since I have checked about 5-6 times during the day, it has shown the consistent values. And as you can see, it is never over the stage 1 hypertension or the stage 2 hypertension, showing that the person is very healthy and doing good. And now here is the mean arterial pressure that shows as 94, and then you have the pulse pressure as 43. And now, for example, if you can go to the weekly statistics, now you're going to monitor this as well and see that across the week, now you have the different vitals. Test counts show about 32 times it has been tested in this week. And now, as you can stretch it and see, you can see the peaks and the valleys of the exact values, what has been encountered with respect to the blood pressure during the week. And if you go and click on the month, it shows you the perpetual digital health records across the month. So historically, what you see is now observable as the visualizations right in the mobile in front of you. Right. Going ahead, likewise, if you want to see the cumulative total across the year, now we are about 166 test counts that have been happened for this blood pressure, and you can see all the details out here. And as you can play around with the UI, you're going to see the values also there, and making it not only for the end user but even for the clinician to have the entire historic data of the consumer or the patient so that they can take informed decisions. This demonstrates basically how the blood pressure works. Now let us take a look at the heart rate as well. Now as you can see, this is the heart rate that is shown, and today as you can see, it's doing in excellent condition with the raster recording. And now if you go on similarly on the monthly tab, it's going to show you the cumulative heart rate, how you are doing across the entire month. And as you can see, well over 55 recordings have taken place, and all the sessions are perfectly normal within the normal ranges. And seeing the cumulative graph of the year, this is going to plot. It's very progressive one, means starting today to the previous year, whatever you have, you can see the data. And as you can see, as I am expanding this, you can see the values over here, what specific value on whatever date, showing the entire history of your perpetual digital health records related to your heart. Now let us explore how the breath rate is going to look like. Now, for example, within the daily chart, then based on the number of tests that you have done. Now, in this case, we have done 5 times during the day. So it's showing the values. Typically, it ranges, it should be ideally less than 30 bpm. Otherwise, there's some serious condition that's going to happen. Now, as you can see here on the breath rate, now we are shown on the monthly graph. It has cumulatively given the entire visualization. Now, if we click on the year wise, now you can see the cumulative graph almost all in the breath rate, about 189 times it has been taken through, and visually it is evident. Now let's explore how the SpO2 or the blood saturation or the oxygen saturation in blood looking like. As you can see, it is perfectly in the normal ranges, in the very high 90s, varying between 97, 99, etc., which is excellent SpO2 setting. Now looking at the monthly tab, for example, it shows you the entire cumulative graph of how it is. Now as I stretch it and show it, now the visualization becomes more apparent, and you can see the consistent values that are hovering well over 95 to 99 range, which is excellent condition of the individual. Now as you can see, now in the cumulative yearly graph, now you can see all the peaks here. And now when we produce, you can see the dots. This sparse metric shows you consistently the UI that is being there, the values represented therein. Now let's explore how the mood and energy is going to look like. This is a very impressive graph where it shows the entire plot of how well you're doing mentally, right from your mood, which could be calm, excited state, to anxiety, stress, and depression. Now, the various sectors that you are seeing represents different choral connotation. You're going to see the anxiety to depression to stress, and then in the terms of energy, you can see it as normal. Then you can see it tired or very tired, or in some cases fatigue. As you can see here, there's a small bar that shows, the sector that shows that you are very tired and then fatigued as well. Now let's take a cumulative look at the ECG video also. Now the ECG video in the format, it's a PSQRT waveform but shown in the video format, and today about 8 times it has been tested. And if you look at the monthly side, now you have almost the cumulative graphs being shown up, and likewise your entire year-wise ECGs also you can see. Perhaps about 294 ECGs have been taken, and the video perspective you can see this. Alternately, there is some static value also that you can see whether it is normal or not. Now let's look at the physical activity, which gives you the not only the step count during the day but even the total distance either in miles or in kilometers, and based on the setting and the calories that you have burnt. Now taking a monthly snapshot for the doctors, clinicians, or the sports athletes, they can self-reflect and see that what's the cumulative distance that they have covered during the week or during the month, and likewise the calories that are burned, and the kilocalories can be converted into the METs as well. Now looking at the cumulative chart of the year, now you have the total distance that is happening, and which is 186 miles, for example, just as the reference point, and then almost 44.19 kilocalories burnt. Now this demonstrates basically the vital signs monitoring, one aspect, and then the basic mental health, and your physical activity. Now let's take a look at quickly at the sleep monitoring as well. Now the sleep monitoring also, this screen demonstrates this REM sleep to non-REM sleep and your sleep patterns, wherein what time you are sleeping, waking up, and the duration of the sleep as well. Now this underlines the total capabilities of the Proactive device enabled by with the RM application app. Thank you very much for your attention and look forward to see you again. For more information, you can go to www.proactive-healthcare.com for more details. Thank you.